morning, everyone. I'm going to continue my topic this week on lung cancer. We did do that last week. I started the segment where I spoke about what is lung cancer. I also gave some background on the lungs. We talked about the signs and symptoms of lung cancer, how to prepare for your doctor's appointments, different diagnostic tests that are done. And now I'm going to continue with the rest of the PowerPoint slides. So the types of lung cancer, I did touch on this. This was my last PowerPoint for last Sunday, but I'll reread it again. Lung cancer, there are two types, general types, which is one is a small cell lung cancer. And the small cell lung cancer occurs almost exclusively in heavy smokers and is less common than non-small cell lung cancer. The non-small cell lung cancer is an umbrella term for several types of lung cancers. Non-small cell lung cancers include squamous cell carcinoma, adenocarcinoma, and large cell carcinoma. So what are the complications of someone that has lung cancer? They get shortness of breath. People with lung cancer can experience shortness of breath if cancer grows to block the major airways. Lung cancer can also cause fluid to accumulate around the lungs, making it harder for the affected lung to expand fully when a person inhales. Coughing up blood is called hemoptysis. Sometimes bleeding can become severe. Treatments are available to control the bleeding, however. It causes a lot of pain. Advanced lung cancer that spreads to the lining of the lung or to another area of the body, such as the bone, can cause excruciating pain. So that's something that the person want to make sure that they follow up with their doctor so that the pain can be managed appropriately. Again, fluid in the chest, which is called pleural effusion. The lung cancer can cause fluid to accumulate in the space that surrounds the affected lung in the chest cavity, and that's the pleural space. Fluid accumulating in the chest can cause shortness of breath. Treatments are available, however, to drain the fluid from the person's chest and reduce the risk that pleural effusion will occur again. The cancer can spread to other parts of the body, which is called metastasis. Metastasis to other parts of the body, such as the brain and bones. Cancer that spreads can cause pain, again, nausea, headaches, and other signs and symptoms depending on what organ is affected. Once lung cancer has spread beyond the lungs, it's generally not curable. Treatments are available to decrease the signs and symptoms to help a person live longer. Treatments. The doctor will choose a cancer treatment plan based on the number of factors, such as the overall health of the individual, the type and stage of the cancer, and the person's preference. This includes chemo, radiation, targeted drug therapy, immunotherapy, and palliative care. Surgery. During surgery, the surgeon works to remove the lung cancer at a margin of healthy tissues. They do what's called a wedge resection, segmental resection, lobectomy, or a pneumonectomy. And those are pictures of what that looks like. It shows the area that will be taken out. Now, let's get some facts about the lung cancer. Percentages of new cancer cases and cancer deaths worldwide. So lung cancer is 11.6% of all new cases that has been happening. It is actually leading over breast cancer, or in tying with breast cancer, I should say. The mortality, lung cancer, 18.4% of all lung cancer deaths. So it's a pretty high number for that. Lung cancer in Canada. Most common cancer in Canada would be lung cancer, 98% of the adults that are there. Estimated lung cancer statistics here in the US. New cases, you see the percentage amongst female versus male. Females are getting up there, so a lot of women are smoking a lot, and a lot of women are being exposed to a lot of the carcinogens as well, and the risk factors as well as the deaths. In Jamaica, according to the latest World Health Organization data published in 2020, lung cancer deaths in Jamaica have reached 2.7% of total deaths. And Jamaica is a small island, so that's a pretty high number for such a small island. How to reduce the risk of lung cancer? We advise don't smoke. If you've never smoked, don't start. Talk to your children about not smoking so that they can understand how to avoid this major risk factor for lung cancer. Begin conversations about the dangers of smoking with your children early so they know how to react to peer pressure, as smoking has become increasingly at a high percentage in schools among teenagers. Stop smoking. Stop smoking now. Quitting reduces your risk of lung cancer, even if you've smoked for years. Talk to your doctor about strategies and stop smoking aids that can help you quit. Options include nicotine replacement products, medications, as well as support groups. Avoid secondhand smoke. If you live or work with a smoker, urge him or her to quit. At the very least, ask him or her to smoke outside. Avoid areas where people smoke, such as bars, restaurants, and seek out smoke-free options. A lot of hospital settings also have made their campuses smoke-free. So anyone want to smoke, they have to literally leave the campus ground and go on the streets to smoke. Factors that influence stage 4 lung cancer. Over age 70, we talked about that earlier, about the different risk factors. Women are less likely to die from lung cancer versus men. Other ways to reduce your risk. Test your home for radon. Have the radon levels in your home checked, especially if you live in an area where radon is known to be a problem. High radon levels can be remedied to make your home safer. For information on radon testing, contact your local Department of Public Health or a local chapter of the American Lung Association. Avoid carcinogens at work. Eat a diet full of fruits and vegetables. You want to choose a healthy diet with a variety of fruits and vegetables. Food sources of vitamins and nutrients are best. Avoid taking large doses of vitamins in pill form, and that may be harmful. So you have to know what vitamins you are taking and what you should not be taking, because not everyone should be taking every vitamin. For instance, researchers hoping to reduce the risk of lung cancer in heavy smokers give them beta-carotene supplements. Results show those supplements actually increase the risk of cancer in those smokers. Exercise most days of the week. If you don't exercise regularly, start slowly. Try to exercise most days of the week. Coping and support. A diagnosis of cancer can be overwhelming. So whether it's lung cancer or any form of cancer, can be overwhelming for any person as well as for their loved ones. With time, you'll find ways to cope with the distress and uncertainty of the cancer. Until then, you may find help to learn enough about lung cancer to make decisions about care. Ask your doctor about lung cancer, including your treatment options, and if you like, your prognosis. As you learn more about lung cancer, you may become more confident in making treatment decisions. You want to keep friends and family close. Keeping your close relationship strong will help you deal with your diagnosis. Friends and family can provide the practical support you'll need, such as helping take care of your home if you're in the hospital. And they can serve as emotional support when you feel overwhelmed by cancer or any illness. Find someone to talk with. Find a good listener who's willing to listen to you talk about your hopes and fears. This may be a friend or family member or a clergy. The concern and understanding of a counselor, medical social worker, clergy member, or cancer support group also may be helpful. Ask your doctor for support groups in your areas, or check your local and national cancer organizations, such as the National Cancer Institute or the American Cancer Society. I want to give special acknowledgement to the Mayo Clinic, the American Cancer Society, Knight Cancer Institute, Lung Cancer Research Foundation, the World Health Organization, Very Well Health, and Canada.org. If there's anything that I did not cover in my summary, or anything that I've covered in my summary, and you have any questions, I implore you to join us in the Zoom room, where we have a good time chatting, getting to know each other, and I'll be happy. And I also have a segment to answer any questions for you. Thank you for your time. Thank you for your patience. God bless you. Have a wonderful rest of the week.